I'm Dr. Arindam Naskar. Today I'll be discussing on hypertension or high blood pressure and how to prevent it. Why it's important? Because in our country there is almost 220 million hypertensive patients are there, and amongst them only 12% patients are well controlled of hypertension. Generally, everyone would like to have normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates blood pressure against the walls of the blood vessel. This is called blood pressure. Normally, in a healthy person, it rises and falls throughout the day. But when blood pressure remains higher for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, for example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, and stress, etc. There are also other risk factors that can also increase the risk of high blood pressure, such as age. Age is one of the most important factors. As people get older, the arteries get stiffen up and narrow as excess fat builds up. And family history of high blood pressure is also important. If one or more family members with hypertension is there in the family, there is increased the person's risk of developing the condition. Excess salt intake is also known to raise blood pressure. And not eating enough foods with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty foods, they also increase fats throughout the body and make the heart work harder to push the blood into the blood vessels throughout the body, hence causing blood pressure to increase. Another one is stress. Stress is very important as our day-to-day busy schedule. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. So these are the common predisposing factors or the common factors associated with development of high blood pressure. Now moving on, hypertension does not have any obvious signs and symptoms. That is why it's often called a silent killer. It puts people at risk of several diseases, from cardiovascular diseases to like heart failure to kidney failure, stroke, eye damage, and even blindness. Hence, early and accurate diagnosis is very much needed in management of hypertension. Measuring blood pressure is the only way to know whether a person has high blood pressure or not. Generally, when symptoms do occur, they include morning headaches or tiredness, sometimes changes in vision, buzzing in the ears, fatigue, nausea, or vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can easily be diagnosed, and it's usually measured by a machine called sphygmomanometer. You often see in our day-to-day practice, in our OPD, in our clinical setup, sphygmomanometer is a very common instrument. A blood pressure is recorded in two numbers. One is systolic, another is diastolic. Now let's try and understand what does it mean and what these numbers actually mean. A normal blood pressure should be lower than 120 by 80 millimeter of mercury, or it can also be read as 120 over 80. Here, the upper number indicates the systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates the diastolic blood pressure, that means the pressure in the blood vessels when the heart rests in between beats. Now, if the blood pressure is more than 140 or 90 millimeter of mercury, then the person is having hypertension. If person have blood pressure levels higher than this, then he or she might at risk of developing serious heart diseases. The risk can be prevented and reduced by taking steps towards a healthier lifestyle, such as regular exercise, healthy diet, quiet smoking and reducing alcohol intake, regular blood pressure monitoring, stress management, and adherence to medicines. And if blood pressure is successfully controlled with such lifestyle modifications, then it might avoid, delay or reduce the need of medication. So let's look at these strategies one by one. So number one is regular exercise or physical activity. Exercise can be a drug-free approach to lowering high blood pressure. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, their heart needs to work less than those hearts who does not exercise, and their heart needs to beat less to pump more blood. So if heart has to work less to pump, the force on the blood vessel will decrease and lowers the blood pressure. In other case, as we are all aware that blood pressure is raises according to the age and the high, if there is gaining of weight. So if the blood pressure is at the desired level, that is less than 120/80, then exercise can help prevent it from rising as you age. So as the age advances, there is more chance of development of hypertension. But if you exercise regularly, then there is less chance of developing hypertension. So regular exercise can help you maintain a healthy weight also, which is my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic exercise most of the days per week. And high blood pressure levels can be reduced by regular structured exercise such as walking, jogging or swimming. So these are very helpful in maintaining your blood pressure level. Number two is healthy diet. Diet has very important roles to play. Diet has very important roles to play in controlling blood pressure. A diet with a high intake of fruits, vegetables and whole grain is recommended for hypertensive patients for lowering blood pressure. And there are several approaches for hypertensive patients, diet like the DASH diet or Mediterranean diet, eating less saturated and total fat intake, getting diets that are more plenty of potassium and limiting the amount of sodium in the diet and limiting alcohol consumption. Now what is DASH? DASH stands for dietary approaches to stop hypertension. Eating a DASH diet that is rich in whole grains, fruits, vegetables and low fat dairy products can help lowering blood pressure even up to 11 mm of mercury if the patient is having high blood pressure. And next is reduce sodium in your diet. Even a small reduction in the sodium in the diet can improve the heart health and reduce blood pressure by about 5 to 6 mm of mercury if you have high blood pressure. To decrease the sodium in your heart, you can consider tips like number one, read food labels that is written outside the container. If possible, choose low sodium alternatives, all the foods and beverages you normally take. Number two, eat fewer processed foods because only a small amount of sodium is present in natural food, but during the food processing, extra sodium is added. So you can eat the natural foods. Number three, don't add extra salt. Just 1 level teaspoon is sufficient and it contains 2.3 gram of sodium. Avoid adding extra salt to food. Use herbs or spices to add flavor to your food. So that are the few tips to reduce the sodium intake in your diet. Number three is quit smoking. Smoking is really important because quitting smoking is really helpful for our heart because it not only reduces blood pressure but also quitting smoking can effectively reduce the risk of heart disease and improving your overall health. Number four is regular blood pressure monitoring. That is very important because some of the hypertensive patients, they only check their blood pressure during their doctor's visit. But I already mentioned previously that in our day-to-day busy schedule, it's often very difficult to check the blood pressure in a chamber. So I often counsel my patients to check their blood pressure by their own at their home. So that they can check many times in a day because that will predict their cardiovascular morbidity and mortality. So I would suggest you to advise all of your patients to check blood pressure at your home because that will check throughout the day and that will definitely helpful. And self-monitoring definitely helpful because that will predict the cardiovascular morbidity and mortality. Number five is stress management. Stress is really an important part of our day-to-day life. So managing stress, how to tackle stress and relaxation technique is really important, like the meditation and listening to music. That is really important for a stressful life. So managing stress is really important because stress can cause lots of cardiovascular problems. And number 6 is adherence to medicines is really important. We often see that some of the patients, when their blood pressure levels are controlled, they often stop medication. So do not stop your medication unless your doctor's advice. So continue your medication and at a proper time. And amongst also, having all said that, I'll say that at last I would like to say that maintaining a healthy lifestyle is really important for our cardiovascular benefit, and a healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented and can be controlled if you properly monitor that, and if you properly monitor your stress by your proper diet and above all exercise. So thank you all for your kind listening.